Hi viewers, this is Dr. Muhammad Iftikhar Islam from Pakistan. Today I'm going to present a lecture on ovine epididymitis, which is caused by Brucella ovis. In today's lecture, we will cover the information regarding the organism that causes ovine epididymitis and its epidemiology. We will also talk about the history of the disease, how it is transmitted, species that it affects, and the clinical and necropsy signs observed. Finally, we will address in prevention and control measures for the ovine epididymitis, as well as the actions to take if the ovine epididymitis is suspected. The ovine epididymitis is caused by Brucella ovis, a gram-negative coccobacillus or short rod. This organism is facultative intracellular pathogen. The Brucella species can persist in the environment invariably depending on the temperature, pH, and humidity. Due to its illustrious history, the brucellosis has many different names. The disease is commonly known as indolent or Malta fever in humans and Banks disease in animals. The other names are Mediterranean fever, the rock fever of the Gibraltar, and the gastric fever in humans. And the other names in animals are like enzootic abortions, epizootic abortions, slinking of calves, ram epididymitis, and contagious abortions. The Brucella ovis infects the sheep as well as the farmed red deer in New Zealand. The experimental infections have been reported in goats and cattle, but there is no evidence that these species are infected in nature. The Brucella ovis is often transmitted from ram to ram, passive venereal transmission via ewes. Ewes can carry the organisms in the vagina for at least 2 months and act as mechanical vectors. Some ewes become infected and shed Brucella ovis in the vaginal discharges and milk. The rams often become persistently infected, and many of these animals and Brucella ovis intermittently in the semen for 2 to 4 years or longer. The Brucella ovis can also be transmitted by the direct non-venereal contact between the rams. Ram to ram transmission is poorly understood and may occur by a variety of routes, including the oral transmissions. Shedding has been demonstrated in the urine as well as in the semen and the genital secretions. The red deer can be infected by venereal transmissions, direct contact between the infected stacks, and experimentally by intravenous, conjunctival, nasal, and rectal routes. Contaminations of pastures does not seem to be an important method of transmission for Brucella ovis. The incubation period for Brucella ovis appears to be 3 to 8 weeks. The Brucella ovis cause epididymitis, orchitis, and impaired fertility in rams. Initially, only poor quality semen may be seen, sperm motility and concentrations may be decreased, and individual sperms are often abnormal. Later, the palpable lesions may occur in the epididymitis and scrotum. The epididymitis may be unilateral or occasionally bilateral. The testes may atrophy. The palpable lesions are often permanent, although they are transient in a few cases. Some rams shed Brucella ovis for long periods without clinically apparent lesions. Brucella ovis can also cause abortions and placentitis in ewes, but this appears to be uncommon. Infected ewes may give birth to weak lambs that die or soon after birth. The systemic signs are rare in adult ewes and rams. The Brucella ovis can cause poor semen quality in red deer stags, but abortions have not been reported in hinds. Approximately 30 to 50% of all infected rams have palpable lesions of the epididymitis. The Brucella ovis has little effect on the sperm quality in some individual animals, but causes severe decrease in sperm motility, concentrations, and morphology in others. The estimates of the abortions rate in ewes and perinatal mortality vary. Some sources report rates of 1 to 2%, while others suggest that these outcomes are rare. Limited experimental studies have been reported abortions rates from 0 to 8%. Abortions and increased perinatal motility have not been reported in red deer hinds. The microscopic examination of semen or smears stained with the Stamps modifications of Ziehl-Nielsen's method can be useful for presumptive diagnosis. A definitive diagnosis can be made if the Brucella ovis is cultured from an animal pulse field gel electrophoresis or specific polymerase chain reactions, restrictions, fragment length polymorphisms or PCR RFLP can also distinguish Brucella ovis from the other Brucella species. Serological tests used to detect Brucella ovis include enzymes linked to immunosorbent assay or ELISA or agar gel immunodiffusions or AGID and complement vaccinations. Dichelobacter nodosus, which causes foot rot, is reported cross-react with Brucella ovis in serological assays. The Brucella ovis is generally introduced into a flock by infected animals or semen. The prevalence of the infection can be reduced by examining the rams before the breeding seasons and culling rams with the palpable abnormalities. In other countries, the weaner rams may be vaccinated with Brucella melitensis Riv1 vaccines. The vaccination is not practiced in the United States of America. The antibiotic treatment has been used successfully in some valuable rams, but it is usually not economically feasible for most of the animals. Fertility may remain low even if the organism is eliminated. Well, this is the end of our today's lecture. Thank you so much.